Hello, everyone. Welcome back to Morning Rounds with Dr. Ruddy. I want to talk to you today about how cancer can go viral. There is a relatively new, rare form of skin cancer called Merkel cell carcinoma. It tends to occur in older people. It presents as kind of a pink or a red nodule on the head or neck or extremities. And a biopsy is done, and the pathologist says, oh, this is Merkel cell carcinoma, very aggressive. It's treated with surgery, sometimes with radiation therapy. Invariably, it comes back quickly. And in the vast majority of cases, it will kill the patient, usually within several months. So we know that a cancer like Merkel cell carcinoma, which we now know is caused by a virus, a polyoma virus that was actually first seen in 2008 and has been pretty well correlated with this particular aggressive form of skin cancer. We know that on occasion tumor viruses can move very quickly. Ordinarily, tumor viruses tend to play out over a protracted period of time. So hepatitis B or hepatitis C virus may infect the liver, but the patient won't get liver cancer for many years. The same for cervical cancer, HPV causing cervical cancer. The young woman will become infected, but maybe 8-10 years later she develops a cervical cancer. On the other hand, some tumor viruses can work very quickly, Merkel cell carcinoma being one of them. The other that appears to potentially be a very aggressive cancer when the virus, I suppose, is ramped up genetically is the breast cancer virus. There is a form of breast cancer, very aggressive, called inflammatory breast cancer. And consistently, over 70% of the women with inflammatory breast cancer, both here in the United States and in Africa, show evidence of this breast cancer virus. If you've watched any of my videos or you're familiar with any of my work, you'll know that this virus was found in 1936. It is unquestionably the cause of breast cancer in mice. It has been found in many of the animals that we come in contact with, rats, cats, dogs. It's been found in monkeys, and it's been found in between 40 and 94% of human breast cancer. So while we're not entirely certain at this point that breast cancer virus is a cause of human breast cancer, we're very close to being able to prove that. This virus, this breast cancer virus, tends to work slowly, like the hepatitis virus or the virus that causes cervical cancer. On the other hand, in some patients, probably based on a genetic predisposition and who knows what other environmental factors, this virus can work very quickly, causing inflammatory breast cancer, which will appear, looks like maybe just a bug bite or a small infection on the breast. And then within weeks, it has involved the entire breast, frequently moves over to the other breast. The patient usually has a delay in diagnosis because it looks like an infection. She's given antibiotics, it doesn't work. Finally, she's sent to the breast surgeon. By that time, really all hell has broken loose. And then very aggressive treatment is offered. Induction chemotherapy, radiation therapy, surgery, so on and so forth. It has a very poor prognosis, like Merkel cell carcinoma. So, when cancer goes viral, it can go viral slowly, or it can go viral very quickly, as it does with Merkel cell carcinoma. And it appears in cases of inflammatory breast cancer, which represent probably about 5% of the cancers that we see in the United States. It's a little bit more common in the African American population. Again, this might be related to a genetic predisposition. If you have any questions, please post them in the comments below. Thumbs up to you, thumbs down to breast cancer. Thank you.